I'm Dr. Rena Azar, and you're getting this video because you're special, because we have discussed having surgery for your pelvic floor. And I want you to see Katie Henson here next to me. She's a pelvic floor physical therapist. She is specially trained in pelvic floor assessment, evaluation, and rehabilitation. So she's going to do a preoperative visit. So I want you to understand why you're doing that and how important that is. Firstly, what she's going to be doing on you is doing a muscle assessment.
Yeah, that's right. So we'll look at your pelvic floor muscles. We'll look at their strength and coordination, their ability to relax. We'll look for any the muscle detachments like Dr. Azar may have found in you, and we'll assess that. So we'll just get a good baseline screening of those muscles.
Absolutely. And she's also going to work on you with exercises that you can do. So in orthopedic surgery, I think it's a very familiar concept that people may need surgery for their shoulder, for example, or their hip, and that oftentimes your orthopedic surgeon will ask you to work on exercising that joint, those muscles, those bones, in that area that's going to have surgery.
Yeah, that's right. So, so to get the best outcomes after surgery, it's really important to get your muscles strong and get good blood flow going to the area and really prepare them to do the job they should be doing.
Absolutely. And those exercises are helpful afterward when you start to gently try to wake those muscles up and use them after surgery. And speaking of after surgery, Katie's going to do some more evaluation. One is for your activity level.
Yeah, so we're going to look at your walking, your general mobility to see if there are any problems with that we may need to work on a little bit to make it safer and less strenuous for you after surgery, and maybe even look to see if you may need some help with some things just to be safe in your recovery.
Mm-hmm. Absolutely. Sometimes we have to consider somebody maybe taking a walker home for a little bit to protect their abdominal incision from getting too much strain from the way that somebody moves if they've got some limitations.
That's right.
Also bathing.
Yeah, so Dr. Azar really likes you to have therapeutic baths after surgery to help in your healing and make you more comfortable, which is great for people. But some people don't get into and out of the bathtub very easily or safely. And so one of the things that we'll do is to see if you are maybe appropriate for doing that, or if we need to look at something else like a sitz bath option.
Yeah. Other options for how we can keep that wound in the perineal, which is the bottom area, clean. That's really important in the post-operative time period. She's also going to look at lung function. So during surgery, you will be asleep, fortunately, and you will be having somebody do your breathing for you, and your lungs will inevitably after surgery be lazy for a little bit. They get a little spongy on the bottom, and people go home with an incentive spirometer, which is a little plastic device that you will see in the hospital that you breathe into and out of to make sure that we're getting your lungs fully filled. And Katie's going to work with you on a little bit of post-operative pulmonary hygiene knowledge.
Yeah, that's right. So it's really important to learn how to breathe properly so that you're fully inflating your lungs and really getting all that air out when you breathe out, so you get all the vapors and the stuff that builds up in your lungs out. The last thing that you want to do is end up coughing after surgery, and that's no fun, and it increases your intra-abdominal pressure. So
she's going to tell you how to support your abdominal area if you are coughing, and like she said, expanding those lung fields helps to prevent pneumonia. That's why we really care about this, and that's probably one of the biggest advantages to being knowledgeable about how to do proper breathing post-operatively. In addition, she's going to work on toileting, which is basically just having a good understanding of how you can minimize the strain that you put on my repair post-operatively.
Yeah, that's right. So we'll work on how to have a bowel movement with the least amount of strain on your pelvic floor, and with good coordination with your abdominals. And we'll work on how to empty your bladder with the most ease that you possibly can. After Dr. Azar repositions your bladder, if that's one of the things that she needs to do, sometimes it's emptying a little more slowly, and so we need to really optimize our positioning and everything to help empty well. So
Absolutely.
we'll work on that.
And what a great thing to have a preoperative evaluation so that she really knows your pelvis. And if you're somebody who we determine needs to do physical therapy postoperatively, she has seen the pre and postoperative results, and she can get the best efficacy from her physical therapy postoperatively. We appreciate your time and look forward to seeing you and working with you soon.